Okay.
Good evening, everyone. I hope you're doing well. We're very privileged of hosting Dr. Fatima's interview, who's currently working in internal medicine at University of Hospitals of Leicester. Thank you so much for joining us, Dr. Fatima.
Thanks for having me.
No worries. So, Dr. Fatima, we had some questions related to cardiac ischemia. If you allow me to proceed.
Yeah.
So, the very first question is that, what is cardiac ischemia and what causes it?
Okay. So it's a bit complicated. They're just two words. And if you just think about the two words, cardiac and ischemia, cardiac means anything to do with the heart, and ischemia basically means lack of blood supply. So everything in a body functions because blood flows through the body and supplies all parts of the body with enough energy to do the work. If you think about the heart pumps about 70 times in a minute on average. And if it's doing that 70 times in a minute, imagine how much energy it needs to use, which means the heart needs to have a very good blood supply. And there are 4 major vessels that supply the blood to the heart. What happens in ischemia is that the blood flow to the heart, for some reason or another, gets blocked, either partially or completely, and it then results in a variety of problems that we group under cardiac ischemia. The causes are multiple as well. The most common causes are what we call atherosclerotic processes, which basically means that the blood vessels that are supplying the heart are getting lined with fat, and they're causing inflammation and blockade of the vessels, and it then hampers the blood supply to the heart. So things like high cholesterol, high blood pressure, and there are other risk factors like diabetes, and there's some genetic causes as well, and ethnicity, and there are lots of things that contribute towards ischemia, but mostly the underlying process is that atherosclerosis.
Thank you so much, Dr. Fatima. Now, Harim Tayyib would like to ask you a question, if you allow.
Yeah, brilliant.
Thank you.
Our next question is that what are the common symptoms of ischemic heart disease?
Okay. So the symptoms can be quite varied, and there is a lot of work being done on symptoms, because traditionally the symptoms we learn on textbooks are the symptoms that were researched in average men rather than women. So women can sometimes present with rather atypical symptoms, but either way, the most common presenting symptoms for ischemic heart disease are chest pain. So if you look at the videos or posters that are like kind of educating about ischemic heart disease, you'd probably see a middle-aged or an elderly man clutching his chest. So chest pain is the most common one that we come across. Then there are other things like shortness of breath. People sweat profusely when they're having an ischemic condition. They can have vomiting. The pain can go into the left arms, jaws. It can go into the shoulder as well. Sometimes it just goes back. And I said people can vomit as well. And if they're just really unwell, they can pass out as well.
Thank you so much, Dr. Fatima. That was really helpful.
Thanks.
Our third question is that what's the rate of ischemic heart disease in UK, and how do you normally deal with your patients?
So interesting. I was just looking at it this morning because you brought it up. And UK has a population of about 66 million people, and about 2.3 million people yearly get ischemic heart disease, which is about 5% of the population. Now, in the population, there's about 1.5 million people that are men, and the rest are women. So men are more affected by ischemic heart disease than women are. Sorry, what was there another part of the question, or was it just prevalence?
how do you normally deal with your patients?
Okay. So the dealing of the patients is about twofold, because the UK healthcare system is divided into primary care and then secondary or tertiary care. So primary care are general practitioners in the community. So if a person is coming with milder symptoms, let's say starting with very stable angina, which is the mildest form of the disease, and then it goes all the way towards what we call myocardial infarction or a heart attack. So if someone comes with an angina and it's an occasional thing, what they generally do is ring their GP up and be like, look, I'm having these symptoms. And the GP can then treat them in the community with drugs, or they can refer to bigger centers for further investigations or management plans. The management generally starts with taking a good history, because that's the key in ischemic heart disease, trying to find out risk factors, and the GPs are really good at doing it. And in their yearly checkups, they basically look at everyone's risk for ischemic heart disease, and they can then provide information about lifestyle changes. They can give preventative medicines like aspirin if indicated, or cholesterol lowering drugs. They also check blood pressure and other risk factors like diabetes. So it all starts in the beginning, where we are trying to prevent ischemia from worsening or developing. And then if people actually present to the hospital, the investigations would be an ECG, which is a tracing of the heart signals. And they do some blood tests normally, which includes one test called troponin. It's a very sensitive marker of heart injury. When the blood supply stops, the heart cells start to die and leak this enzyme into the blood, which is called troponin. And we've got very sensitive assays these days, and even mild rises of the troponin will give you an indication that the heart's going through stress. After investigations, it depends on what the results are, and if we think someone's having an acute event, then there are a few things that we do. There's aspirin and clopidogrel. They're two antiplatelet drugs. Basically, they thin the blood. So because the atherosclerosis that I talked about initially is clotting of the blood vessels, right? So the blood's not flowing through them. So what we're trying to do is relieve those clots. We also give some blood thinning injections, and then there are certain interventions that can be done. So like, I don't know if you've heard about having a stent put in the blood vessels to try and open them up and get the blood flowing again. So it starts with very basic medicines and goes all the way to going to a catheter lab and getting a stent put in one of your big blood vessels. Does that make sense? I've said a lot of things in a very short amount of time.
Yes, it does.
Okay.
We have already researched on it.
Oh, you have. Brilliant.
So we
I
just
yeah.
there was just one more question I
Yeah.
wanted to ask.
Mm-hmm.
What lifestyle changes can help reduce the risk of cardiac ischemia? Like,
Okay.
are there any specific changes or like overall a change in the lifestyle?
They're mostly overall changes. So as you're all aware about the risk factors, the common ones, right? So there are certain risk factors you can't change. For example, I'm South Asian, I'm Pakistani, I can't change that. That's my ethnicity, and that puts me at risk of cardiovascular disease. If it's a man, he's at higher risk of cardiovascular disease than I am, and he can't change that. But there are certain modifiable risk factors. So like obesity, weight, there's smoking, there's high blood pressure, there's diabetes, and just general physiological health. So whether you're exercising or not. And diet as well. Diet's very important, because obviously all of this impacts on the cholesterol levels and the inflammation in the blood vessels. So for things like hyper blood pressure, diabetes, and cholesterol, you obviously need medical attention. But other lifestyle changes you're asking specifically are, number one, exercise. And for cardiovascular health, especially, there are cardio exercises that are recommended. So walking, swimming, running, and about 45 minutes of cardio exercises at least 3 to 4 times a week. Then trying to maintain a weight within a normal limit. And for weight, there are certain diets. Obviously, you must have heard about unsaturated fats. The Mediterranean diets are highly recommended. They're heavy in fish and fresh vegetables and fruits. A low carb diet is generally good for metabolic health, including cardiovascular health. Quitting smoking and getting help to quit smoking. Drinking alcohol in moderate amounts as well. Yeah, those are mostly the ones I think about. And I think one thing that the UK does very efficiently is they've started trying to incorporate more fruits and vegetables in people's diets. So the recommended portion is 5 portions of fresh fruits or vegetables, or even cooked fruits or vegetables in your 24-hour period. And if you go to any supermarket to buy any fruits or vegetables, it has a green sticker on it, and it would say it's your 1 of 5 or 2 of 5. So basically what it does is it tells you that this is one portion that you need to eat, and you need to have 4 more of these portions in a 24-hour period. So there's a lot of focus on diet.
So sorry for the interruption. Actually, the internet connection was very poor.
That's
So
fine.
Can I ask you a question, a real quick question?
Mhm.
Do you think that regular checkups are important?
Yes, they're very, very important, especially when you hit a certain age, starting in your middle age. And if you have any special concerns, like people who have a very strong family history of heart diseases or strokes, people who are overweight, should get checked. And the checks are simple. If you think about it, the assessment scores for heart diseases are fairly simple. They just check simple things like your blood pressure, your diabetes, which doesn't have to be an expensive blood test. It can just be a spot test. Your weight, your height, to try and find your BMI, and maybe your cholesterol test if indicated. And they can all be put into assessment scores. They're easily available on internet. Different people use different scores, and it can give you an idea of what needs doing, whether anything needs doing at all. And getting in touch with the doctor or a healthcare provider will give you an opportunity to find out what can be done better in terms of lifestyle, exercise. If someone smokes, they can get some help. So yeah, the checks are important because prevention's the key, right?
Right. So Pakistan has 17% prevalence rate of ischemic heart diseases. So what do you think we can do to improve the prevalence rate? Because it's too much.
It is too much. And I would think it's probably undermined. I think it may be even higher. What needs doing are education campaigns. I think they are the most important thing that can happen for people, because simple things like changing your diet, for example, or having a walk in the morning will make a lot of difference in health long term. But this message needs to come across to people. I think investing a lot on getting blood tests done is probably not feasible with the economy, and engaging people still would need education. So that is the key for prevention. And it doesn't have to be, the changes don't have to be drastic. You don't have to turn your whole life around. It's just maybe adding 2, instead of adding 4 spoons of ghee, you can add 2. But then the motivation needs to come from somewhere. And I think it just has to be education, and it has to be a government-led public campaign.
Right. Right. Thank you so much.
And most importantly, I always like to talk about women because there's a lot of gender data ways. I think trying to get women involved in actively trying to that their health is important as well. So like, I know there aren't parks, there aren't spaces for women to walk around, but they can do it inside their homes, but it's just the motivation and the education needs to come from somewhere.
Right. Thank you so much. Thank you so much for joining us and giving us your precious time. It really means a lot.
Brilliant. If you have any questions, just send me an email or send me a text. I'm happy
Thank
to
you
help.
so much. Thank you so much,
Thanks.
Dr. Fatima.
All right,
It
you
helped
have a
us a
good
lot.
day. Thanks. Bye-bye.
Good day. Take care. Bye.
Bye.